Good afternoon, everyone. On behalf of the Council of State Governments, welcome to our webinar today. My name is Heather Schaefer. I'm the Deputy Director at the Center of Innovation at the Council of State Governments, our key national policy shop. Thank you for joining us. Today we'll be discussing the white paper with research and analysis from KPMG to examine the fiscal impact of the COVID-19 pandemic on the states. First, I'll start out with a few housekeeping items. We are on Zoom today, which I believe many of you will be familiar with. This presentation is being recorded and is available for replay. To reduce noise during the conversation, all participants will be muted. If you have a question, please use the Zoom chat feature. We're going to have a Q&A session at the end of the webinar. Where we'll answer your questions for about 10 minutes. And so any questions that you have either now or throughout the presentation that you'd like for us to address, again, please just use the chat feature in Zoom and we will address that towards the end. Also, if you're having any technical difficulty or questions about Zoom on any of these instructions, please just use the chat feature in your menu to type your question, and CSG staff will get back to you as soon as possible. So with that, I want to talk about really the purpose of this research that we proposed in our most recent white paper, COVID-19, the fiscal impact to states and strategies for recovery. Back in April, near the time of the initial shutdowns to help mitigate the spread of the pandemic, we reached out to our members, and in particular, we reached out to legislative fiscal chairs across the state, and we asked them, during these uncertain times, what type of assistance are states looking for in how to respond to the fiscal impact, and what are states doing and thinking about? What are the key variations across the states on how they're addressing the pandemic? One of the key themes that came across that will probably be no surprise to folks here is flexibility. Flexibility within the state and its own mechanisms for addressing the crisis, and flexibility nationally. So as a result of this feedback from fiscal chairs, the Council of State Governments partnered with KPMG to come in and provide some support to us to conduct research and analysis on publicly available information related to the states and the results of that research and the technical assistance of CSG. We have that published in our white paper. And really looking at the study and just the conversations that we've had with states, even the most prepared states with robust rainy day funds, structurally balanced budgets, are facing significant budget shortfall due to the impact of the pandemic. So the white paper looks at the near-term economic risk factors that states are facing. There's many factors about this pandemic that are still unknown. And so what economic risk do states still face as those variables unfold? When we looked at the fiscal gap that states are facing, looking at the most recently completed fiscal year for the majority of states and the current fiscal year that we're in, the combined gap is an 11.2% average. And that varies from a fiscal gap of 6% all the way up to 33% when we look at all 50 states. And so as states look to address that fiscal gap, really this study helps to underline the variations that exist across the state, both in economic risk and the components that allow each state to be resilient and to face this pandemic and the strategies that they'll need to recover. Today, we're going to dive into a deeper discussion to provide an understanding of the analysis within this report. I would like to thank Christina Gordley of the Council of State Governments who assisted in this research. I would also like to introduce individuals from KPMG who are part of this and are joining us today. With us, we have Dr. Uma Radhakrishnan, who is a Managing Director in KPMG's Economic and Valuation Services practice. She's an economist by training and specializes in predictive modeling, forecasting, economic contribution analysis, policy analysis, data analytics, and economic modeling. During the course of her career, she's provided economic consulting to a wide variety of state governments, as well as Fortune 500 companies. Dr. Radhakrishnan received her PhD in economics from the University of Virginia. Supporting Dr. Radhakrishnan is Will Oldfather, also in the KPMG Economic and Valuation Services practice. We also have Josh Hesterman. He is a director in KPMG's infrastructure practice with almost 15 years of consulting experience serving both public and private sector clients. And he brings a wide array of tools and methods to bear on major strategic disruptions that states face, the COVID-19 pandemic being the key one occurring right now. And most recently, he's worked with several state agencies to codify the health and economic factors needed to facilitate a balanced response across the many competing demands presented by the pandemic. So without further ado, I'd like to dive into our content. Uma, I'd like to start with you. What do you think are the key things that states can learn from this white paper?
Sure. Thank you, Heather, for the kind introduction. Hi, everyone. My name is Uma Radhakrishnan. Easier than remembering Dr. Radhakrishnan is remembering Uma, like Uma Thurman. So I am very excited to be here today. Thank you all for joining the webinar to be with CSG and KPMG. So in terms of the key learnings for states from this paper, I think it's important for us to focus on what is the key contribution of this white paper. I think a major takeaway from this paper is that it scores fiscal risk and resiliency for each of the 50 states across a variety of categories. So using the scores, risk and resiliency scores, states can learn how they compare nationally as well as how they compare regionally in terms of their economic, in terms of their COVID-19 specific economic risk exposure, as well as how they compare nationally as well as regionally in terms of fiscal resiliency or how prepared or their level of preparedness to face an economic downturn. So that's probably the core contribution, but looking at it one step deeper, as we all know, the magnitude as well as the nature of fiscal and economic risks of COVID-19 vary across the different states, and scoring fiscal risks across the different dimensions helps states better understand what the continuing economic risk associated with COVID-19 pandemic is in order to be able to more effectively manage the risks. It's not enough just understanding what the risks are. I think it's also, or we think it's also important for states to start thinking about, how to recover from the pandemic. So in order to do that, it's important to identify and understand strengths that the different states have. So to capture that, we analyzed what we call as resiliency factors that help states be better prepared to weather the current downturn as well as future economic downturn. So it's important for states to understand what their relative strengths are, what their weaknesses are, how prepared they are, so that they can start thinking about more targeted solutions. So although I'm talking now about risk and resiliency, I think a major takeaway here is to think about risk and resiliency together as a single unified framework. The risk scores will tell states about their challenges and economic risk exposure, but the resiliency piece will tell them how best to address the challenges that they face, how best to use their fiscal strengths to deal with their economic vulnerabilities so that they can move on towards a path of healthy economic recovery. Back to you, Heather.
Great. Thank you so much, Uma. And I really appreciate your discussion around risk and resiliency. And there was a lot of thought that went into why we should look at economic risk as well as current and long-term resiliency when examining the 50 states. Can you go into a little more detail around why these two dimensions of risk and resiliency were chosen and what that means in respect to states' economic situation?
Absolutely, Heather. So when we started this project, the question that was in front of us was, how do we assess COVID-19 impacts on the 50 states? So the question that we were faced with was pretty broad. And as part of we want to make sure that our analysis offered value and insights to the state leaders so that it would help them with decision making. So to think about what is the best way to address a broad question, but also at the same time offer value, we thought it might make sense to um, analyze the impacts of COVID from a risk lens and from a resiliency lens. And these two together, I think, offer a full picture of what action states can take, again, to support or move towards economic recovery. Just thinking a little more deeply about the risk score itself, what our intention was with the risk score was that we wanted ways to capture current as well as specific challenges that were associated with the COVID-19 pandemic. For example, because of COVID-19, states were experiencing increased Medicaid spending. We also know that there was a lot of pressure because of increased unemployment insurance claims, and states were facing increased unemployment insurance benefits expenditures. The other thing unique about this pandemic was that different sectors were affected differently. Tourism and accommodation and food sectors were really hit badly. Finance and few other sectors were protected because of their ability to pivot and, for example, engage in work from home. So the risk score overall captures the current challenges states are facing specific to COVID-19. The other piece is the resiliency piece. Every state has unique characteristics which affect how they would respond to the different challenges they face. So the resiliency score that we have developed, it tries to address general factors associated with preparedness of states to deal with the current recession as well as future recessions. And these resiliency or preparedness could be considered as good practices for states to be able to weather recession and position themselves for a healthier recovery. Again, this point I cannot reiterate enough. It's important to consider the relationship between both risk and resiliency to be able to give states a complete understanding of their unique fiscal and economic position so that they can make the right decisions in response to the current pandemic. As an example, there might be a state that has highly resilient, but also is also has high risk. So for this state, it's important to understand how they can mitigate their risk with strengths they have from their resiliency factor. So again, this one unified framework we believe would offer states with information to enable more targeted solutioning. Back to you, Heather.
Fantastic. Thanks, Uma. And I really appreciate how, we were really mindful to make sure that we were capturing that each state is unique. And there's a lot of complexity that comes with understanding economic risk as well as a state's resiliency. So can you talk about how did we choose the factors that we would use in order to analyze risk and resiliency, how those categories were selected, knowing that there's a lot of complexity there, and each state is going to have different variables that they can flex in order to help address their current challenges.
Absolutely, Heather. That's a great question. It takes us right to the heart of our analysis. And as we explore, our scoring mechanism and think about, what are the key factors that went into the risk and resiliency scores, it's important to keep in mind the breadth of the question that we are trying to answer here, which is COVID-19 impacts on the fiscal impacts of COVID-19 on the 50 states. So our goal was to come up with a scoring mechanism that could be interpreted in an easy to understand manner, that was straightforward, but yet at the same time provided key insights in a clear and concise manner, while at the same time taking into account relevant information. Again, question is pretty broad, so we have 5 risk factors and 6 resiliency factors. It doesn't cover everything, but we believe that it is a representative sample of important factors. And one of the things I can ask my colleague Will to share as we go through a deeper dive of the risk and resiliency factor is a Tableau dashboard view of how different states have fared on a resiliency standpoint as well as on a risk standpoint. So you can take a quick look now, and then we can come back to this chart. So if you look at the risk score, the fiscal or economic risk score, we have 5 different components here. One, we looked at revenue decline percentage for each state and compared that with the pre-COVID revenue estimates. And this revenue decline percentage was the adjusted or re-estimated revenue forecast once COVID-19 hit. We looked at another component of the risk score is the estimated state fund Medicaid expenses increase. Yet another component is what is going on in terms of estimated unemployment insurance payment sustainability for each state. And the 4th factor here is the composition of each state's gross domestic product by industry. We know again that COVID-19 has hit different states, different industries differently, and we wanted to account for that in developing each state's risk score. And finally, our 5th component of the risk score is the targeted financial market return percentage for pension investment fund. What I want to do right now, again, you may be, if you're from different states, you may have a red for your state, green for your state. One thing I do want to point out is that for each component here, which I will go in detail, not too much detail, some detail, a state can either score a 0 or a 1 for each of these 5 components. 1, higher the number, more risky it is, the color becomes more red. So a state's risk score can vary between 0 and 5. Let me walk you through some of the logic, but even before that, I do want to start out by laying out caveats here. Some of the caveats are the more obvious ones. For example, everything around us is changing. When we put together the paper, sometime in mid-June, COVID numbers were 2.4 million. Now it's 5 million. So one thing I want us to keep in mind is that there is so much uncertainty out there. Things are evolving, things are changing and changing rapidly. The other piece to keep in mind is that the risk scores that we developed are based on information we had at the time of the analysis. In reality, what may materialize is that a state's risk score may be more severe or it could be less severe depending upon public policy interventions, health policy interventions, depending upon how quickly COVID is, how quickly COVID infection rate is contained and so on. So multiple factors affecting what the risk scores would be. So what I'm going to do in the next few minutes is talk through the reasoning for why we picked these different risk factors. I'm not going to go into the detailed formula or the detailed methodology, but I'm going to try and give you the intuition behind some of the choices made. Also, I'm going to stay away from digging or poking into what happened with the specific state, only in the interest of time. And all right, so perfect. So the first risk factor to consider, which we think is a really important one, is what is the impact of COVID-19 on revenue loss projection or on general fund revenue? Another broader message I should mention is that COVID-19 pandemic is very unique, very different. One, because it's widespread, and the other reason it's very abrupt, right? So one day states shut down, businesses were shuttered, schools were closed. Usually when recessions happen, we gradually get into it, but nothing is as sudden and as intense as our current pandemic. So just digging deeper into the revenue loss projection or declining general funds revenue, everything shut down abruptly, or I should say a lot of the economic sectors in different states shut down abruptly. Economic activity in some parts of the country slowed down. In some instances, there was also moments of activities being in a standstill mode. So what did that mean? It meant that there was a sudden shock to the revenue streams that states were facing due to decline in sales tax revenue, due to states not collecting withholding tax from employers, and so on. So the revenue loss risk is calculated here as, what is the estimated revenue shortfall compared to what was the pre-COVID expected revenue estimate. So here a score of 1 was assigned if the estimated revenue shortfall was greater than 8%. The second component was the Medicaid spending increase. Under the COVID pandemic, demands placed on the Medicaid system has increased significantly due to a couple of reasons. One is large number of people lost their employer provided insurance due to either closures or layoff, and they became eligible for Medicaid enrollment. The second was the pressure on the health system because COVID-19 is a public health crisis. Medicaid expenditures are expected to rise and have been increasing due to COVID-19. So we, again, calculated a measure for Medicaid expenditure risk here. The other metric we have is sustainability of UI benefits. So during recessions, right, states face increased fiscal risk associated with increased volume of UI claims and associated UI benefit expenditures. And different states, we know, have different levels of UI trust funds available to meet the anticipated unemployment insurance claim that comes up during a typical recession. Again, COVID-19 is unique in that unemployment claims, even during the weeks that we tracked here, were significantly larger than the unemployment claims during the great 2007 through 2009 recession. So the fiscal risk that states face, so to evaluate the fiscal risks that states face, we have to look at what is the additional unemployment claims filing during COVID-19. And solvency for, and what is the additional unemployment claims, as well as how are states faring from an unemployment trust fund solvency perspective. So taking both these pieces of information into account, we estimated how, for each state, for how long can they continue paying out unemployment benefits. And we set our threshold at 12 weeks, or if a state could do payments for more than 12 weeks, we said it's not risky. Again, caveat of the study, things are changing. We are now on month 5. When we did some of the analysis, it was a month and a half ago. The next piece is the economic sector-based risk. Like I mentioned, COVID-19 is unique in that it has affected different sectors very differently. And we need to account for the fact that different states have different GDP composition broken out by sector. Some states may have a large dependency on tourism. Some states may be more dependent on finance. Some states' government sector may play a key role. So one of the things we had information on at the time the study was done was we had observable data on employment changes by sector. So what we did was we weighted, for every state, we weighted each component of the GDP by the size of its industry and looked at employment changes. So for example, a state that relies heavily on tourism, we looked at, what is the employment loss in the tourism sector. So the riskiness of that state went up because of one, this state had, let's say, 60% dependency, I'm making this up, 60% dependency on tourism, and tourism job losses was 40% during the window we observed. So the hit on the state is large. So we did create a measure that accounted for the industry sector-based risk. And the final component of the risk factor is, pension reliance on market returns. So we know that state contributions to pension funds in the recent times has become a big ticket item. So to capture the risk position of various states as it pertains to pension trust investment, we looked at the state's benchmark rate of return on their pension trust fund. This is the rate of return that is needed to keep the gap from the state and employee contributions and the pension obligations from growing. So we look to see if the benchmark rate for a particular state was greater than our set threshold, then the state was assigned a risk score of 1. So these were the 5 risk categories we looked at. I'm going to turn it back to Heather to see, Heather, if you wanted to comment on our risk analysis.
Absolutely. I think the key thing here to remember, and you touched on it, Uma, in your discussion, is these are a series of factors that may be influenced by additional policy decisions. So when states are looking at strategies for recovery, this provides a framework of considerations or options for states to look at and understand as to whether or not there are public policy actions that can be taken in order to mitigate some of the future economic risk that states might see as a result of unique factors of this pandemic. And so I think that's part of the story of COVID and this pandemic, is that there are a lot of unknowns and things are ever changing. And so it's important for states to both look at policies that allow flexibility to adapt to those changes, but then also policies and programs that help mitigate some of these risk factors as we continue to learn more and more about how the pandemic is impacting each state uniquely.
Perfect, thank you. For the resiliency score, we have 6 of them, but in the interest of time, I'm going to mention what 6 we considered and maybe walk you through 1 or 2 just to give you a flavor. But similar to how we had a Tableau view showing the risk score, we also have a Tableau view showing the resiliency score. So that's the view that's on the screen right now. Again, here, green is good. Higher the number, better it is. A state could end up between 0 to 6 on the resiliency scale. 6 is good. So what are the things that we considered here? We looked at the rainy day fund coverage in each state, or rainy day fund in each state. We looked at, what is the debt service coverage, which is the operating income as a percentage of the debt interest expense in every state. We looked at the pension funded coverage. Some are more intuitive than the others. As I explained some of them, it'll be clearer. We looked at the unemployment insurance trust solvency. We looked at, how is the state doing from an average state covered Medicaid expense per enrollee perspective. We looked at per student K-12 education funding and saw whether it was higher than the pre-Great Recession level. So I'm going to take about 30 seconds for some of these components. I know it's 2:32. We have up to 2:45 for the entire session. So I think the most interesting ones are the rainy day funds. So again, here to keep in mind that each of these resiliency components shows how prepared states are to come out of or to face challenges brought out by this pandemic. And the other point to keep in mind that although most states were better prepared for a recession compared to the 2007 and 2007 through 9 recession, many states were not adequately prepared for this recession, which of course is not surprising given the intensity and magnitude of the current one. So I'll talk through one or two resiliency factors again to give you a flavor. Definitely the rainy day funds. So towards the end of fiscal year 2018, more than 50% of the states had increased their rainy day funds compared to as a share of their budget compared to their position in 2007 through 2009. Although the trend in rainy day funds amount has been increasing over time, only about 6 states had rainy day fund balances that met the government finance officers recommended 16% of general fund revenue threshold. It's important. And why are rainy day funds important? It can be used for offsetting general fund revenue declines. It can be used to support small businesses and so on. So we did look, so higher the rainy day fund balance, more resilient is the state. Using that, we said, okay, if rainy day fund balance, we calculated the rainy day fund balance resiliency for the different states by dividing the state's rainy day fund balance at the end of fiscal year 2019 by their fiscal year 20 pre-COVID estimated general fund revenues. Again, a score of 1 was assigned if rainy day fund balances was greater than 1 month of general fund revenue. I want to quickly move on. I mean, in the interest of time, just talk about one more category, which again here is state K-12 education budget, and give you some additional context there. Medicaid cuts, general fund education expenditure cuts are all some of the main targets for being cut during recession. So in states in 2007 and 2009 recession, were less prepared, as we discussed, and they had less rainy day fund balances. So at that point, many states were forced to cut their education, K-12 education expenditures. So now today we looked to see how the education funding had recovered across individual states, and we used that as a measure of fiscal resiliency. So for states that had made huge cuts in education and had never actually caught up between the previous recession and now, had very little bandwidth in terms of using education expenditure as a lever to manage overall expenditures. So this is where it's important to understand where states are from a resiliency/preparedness perspective. Heather, I'm going to pause here, turn it back to you.
Certainly. Uma, thank you so much for that overview. And for those following along on the webinar, You can access the full report on the Council of State Governments website. And in that report, we dive into the specific data points from each state that led to these scores, as well as the definitions and approaches for how these scores came about. One key note, and Uma, I'll ask if you've got anything to add. This was obviously a point in time study, and as we've mentioned, not only is COVID and its impact to states continuing to change, some of these data points are also continuing to change as states take action to address the pandemic. CSG, as a membership association, we're continuing to support states and answer questions and provide technical assistance around this into the ongoing future. So feel free to certainly reach out. But Uma, anything to add around just the data that was leveraged for the analysis and maybe how recent that data was?
Absolutely. So some of the main data sources that we used were the US Department of Labor. We pulled data from the Bureau of Economic Analysis, from NASPO state fiscal and expenditure reports. We pulled information from Bureau of Labor Statistics. We leveraged a study done by Moody's Analytics on stress testing states, which was a fairly recent study. We looked at a Pew Charitable Trust Fund for pension data. We again looked at a National Center for Education Statistics for some education data, and as we did the study, our goal was to leverage the most recent data available. So for employment changes data, it was as late as May timeframe. But for some of the pension data, we had to go back a year or two. For full GDP data, I think we went back a year for sector level GDP breakdown. But the bottom line is we used the most recent available data at the time of the analysis. But again, like we discussed, things are evolving rapidly. I think even by the second, if I could say that. But again, the main takeaways we want to bring forth is, right, what are some of the areas should states focus on? How should they consider the relationship between, what is identified as a risk and what is identified as a strength? Back to you, Heather.
Fantastic. Thanks, Uma. That's very helpful. And so we will, just a reminder, if you have questions, feel free to submit those via the chat. I already saw a couple questions coming in. We will wrap up our discussion here in the next couple minutes, and then go into by around 2:45-ish, and then we'll go into Q&A. So now I want to shift. So we've got this foundation of understanding where states are at with their economic risk as well as their resiliency. So I want to shift now into what are we seeing as options for states when it comes to strategies for recovery. And Josh, I'll kick it over here to you in a moment. But I'll underline, flexibility has been key. There's already a number of states that are taking action to look at their budget process. Many states have had to call special sessions, others have taken executive action, but flexing all of those options and adjusting them as necessary to make sure that there's flexibility to address the challenges of the current fiscal year as well as future fiscal years is gonna be key. We've already seen, I think as of last week, it was 43 states that have taken action to reduce their budget. Many of these have been based on flat reductions across the general fund. We've seen very few states actually take action to date on adjusting revenue sources. So interested to see how that continues to evolve. States are currently focusing on reducing expenses, but we anticipate from our discussions that more and more states are going to start looking at what are their options on the revenue side, whether it's looking at cap structures, debt structures, et cetera. We go into more detail in the white paper, so don't want to belabor this too much, but one of the things that I think is key, and we're even seeing some in the chat of just, this is going to be a shared conversation that we continue to work through as the pandemic unfolds. And so local and regional collaboration is going to be key. We've already seen a number of states create regional pacts as they look at both shutdown orders as well as looking at options for renewed economic opportunities. And so I think that regional collaboration, particularly where there's shared industry, is gonna be key. So moving into some additional specifics around strategies for recovery, Josh, what are you seeing from your vantage point?
Yeah, sure thing. In the beginning of this, I'll admit it's going to be a little bit of a broken record here because the framework, as I see it, starts off with flexibility. I don't think that there's any way of getting away from trying to maximize the number and the magnitude of opportunities that we have to respond to something that's just this uncertain. And so, we're seeing a lot of states that are responding with, as you mentioned, being able to call special sessions. We've even seen some states who have lengthened their fiscal years to kind of give yourself a little bit more time to be able to figure things out and add some of these data points that Uma spoke about to see, how is this trend resolving itself. So that's kind of the first of three things that I tend to think about. And sort of in the middle of the framework, I think of confidence around, are there any specific policies that you can put in place, even though we're sort of backing off and trying to give ourselves that budget flexibility, that show a level of support and kind of a light in the darkness, if you will, for what things might look like tomorrow. And so we're seeing, various states and agencies committing to continuing to commit to emergency response funds, whether that be in health, which obviously makes a lot of sense at this point, or specific small business, nonprofit support, things like that. So that sort of is this middle portion that we think of as starting to build confidence as we come out of COVID and we begin to figure out what things will look like in the new normal or the next normal, as I feel like I'm starting to think about it. And then the final one is again broken record a bit, is really resilience. When we're thinking about a world sort of post-COVID, how are we setting ourselves up with the policy choices that we make to be able to come out of this stronger? And so, we're seeing a lot of different agencies going out and trying to use this as an opportunity to, even with a limited budget, figure out if there are specific initiatives that may be able to increase their capabilities for remote working, for digitization, for being able to be that much more flexible in the future. And so I think that kind of using that progression of the flexibility, the confidence, and the resilience will give us a bit of a path out of COVID and remind people of that this will be painful, but like you had said quite well, Heather, it's a conversation that we all need to have, and it's a pain that we will learn how to bear together. So that's just a few of the things that we've been seeing in the market and across the states lately.
Fantastic, thank you, Josh. I think one of the key themes that I take away from this report is just underlying the variations that exist from state to state. There's a phrase that we often use around the office: if you've seen one state, you've seen one state. Each state has a unique political environment, different factors influencing risk and resiliency. And so each state's going to need a unique approach depending on the levers that can be adjusted in order to help address the pandemic. So we hope that the insights in this paper have been of value to you, and we look forward to continuing the conversation with you. There's some links that Christina's providing in the chat for you to access the full report. You can also feel free to reach out to CSG with any questions. We do have a number of questions in our chat that we want to touch on, and so I know there's one of the first questions we had how did researchers define operating income for debt service coverage? Uma or Will, do you want to take that question?
Bill, go for it.
I can, and I just shared in the chat as well, but this was, for purposes of debt service coverage, the operating income was own source general fund revenues as well as other revenue sources, and then offset netted off of total expenditures, although debt interest expenses were excluded from those expenses for the purpose of comparing the operating income to those debt expenditures. So hopefully that clears that up.
Fantastic. We also had a question as to whether the slides would be available afterwards. That was in a data system called Tableau, but that very data and the image of the US that Will was showing earlier, that is available in the full report. So Christina's got that link there. Want to turn to a question on states like Massachusetts. So for states like Massachusetts that have not issued an official updated revenue forecast, how are the revenue shortfalls calculated? Will, you want to take that one as well?
Sure thing. Yeah, so where revisions were not available at the time of the analysis, we actually took a regional average. So just comparing the CSG defined geographic region average revenue shortfall, although adjustments were made for differences in fiscal year end months. So states with longer or an offsetting fiscal year, we adjusted accordingly so that we were comparing similar magnitudes of time after COVID-19.
Fantastic. And those regional averages, I believe we've got that in the detail of the report as well. We have a question, how can anyone plan with the two great unknowns challenging us? Obviously, we are in interesting times. I think that's why we continue to talk about the theme of flexibility. State leaders have the ability to put policies and programs in place that allow for flexibility. Flexibility at the local level, at the state level, and certainly through regional collaboration and across the aisle collaboration. That way that states can make the most informed decisions that they can at the time that the decisions are needed. And as new information becomes available, states will need to adapt. There's going to be things that we find out 6 months from now that we don't know today. And so it is certainly not an easy task that we all face. And looking forward to, I think, the conversations that unfold. And I think that we'll also see some really bold and creative strategies come out of the states. Some states may take the approach of small incremental changes, but this is a time also where there's an appetite for bold strategies.
Heather, I just wanted to add on to that a little bit. Something you mentioned a second ago sparked a thought around covering the revenue side as well. And a lot of state agencies are also, pre-COVID as well, we're looking to diversify their revenue sources. And I think that that is also one of the ways that you kind of plan under uncertainty, is just providing yourself some optionality that can give you a bit of buffer, knowing that you're going to get the wrong answer and we're not going to forecast things perfectly. But it does give you kind of a new sort of defensive play that you can use by having that arrow in the quiver.
Fantastic. Thank you, Josh. One question that came through was, how did you account for the Federal CARES Act funding in the resiliency calculations? And so, Will, I'll kick it to you to see if you've got anything to add. That question came to me privately, but did want to address, so the federal piece is obviously a a question that is out there, and it's a big part of the conversation. It's a conversation that the leaders of CSG, as well as the other big 7 state membership associations, are having with states and with the feds. And so with that piece for resiliency, because it's an unknown, we did not factor that in. We acknowledged that it is a component that is going to be a key piece for states to consider. But knowing that the initial funding had a number of restrictions around how that could be used, we did not want to, at the time, factor that into the resiliency calculations, but do acknowledge that in the report as a key factor that states, as well as CSG, were absolutely keeping an eye on that as that unfolds. Will or Uma, anything to add to that?
I think that's exactly right, Heather. That flexibility was obviously something that came up, when CSG was surveying various budget office and state representatives. So it is definitely on, something that we've focused on. I think due to those flexibility and restrictions that limited some of the uses and made it a little bit uncertain, that CARES Act funding was not directly, from a calculation perspective, was not directly included in our views of shortfall or rainy day fund coverage.
Fantastic. And just a reminder, any Q&As, please submit through the group chat. Will, Christina, did I miss any other questions that came through? I believe that we have addressed all questions. I will put the CSG contact information in the chat. Should you have any questions as you look at the white paper that was released, or as you reflect on this webinar, or as new questions arise in your day-to-day work with states and as state leaders, please do not hesitate to reach out to the Council of State Governments. We are here as a resource to support states. We will also continue to have additional analysis and information that comes available to follow on to the great work that is in the white paper, where KPMG provided phenomenal support to us around the research and analysis of the risk and resiliency factors. As we've said throughout this study and this conversation today, this will continue to be a long conversation ahead. It's affecting states not just in the short term, but it will also affect states in the long term. And so we continue to keep an eye on things and look forward to hearing from you how you're seeing things play out in your state and across the country. Uma, Josh, Will, Christina, those joining us as speakers, anything else to add or to underline as we look to close and provide closing thoughts on this webinar?
I think your summary was pretty effective, Heather. I would just say that things are evolving. There is uncertainty. There is only limited actual information. A lot of it we can figure out once events take place, but to figure it out ahead of time is hard, especially given uncertainty around how COVID-19 is spreading, how can it be contained, what is going to be impact of different policies, how long would unemployment, supplemental unemployment benefits come in from federal government. If that stops, what's going to be the impact on consumer spending? So we have looked at data on some of the direct effects of COVID-19, but there's going to be subsequent ripple effects that's going to come through. And we can start thinking about how to quantify it, but something to keep in mind as we look at the analysis.
Fantastic. Thank you so much. Again, on behalf of the Council of State Governments and our great thanks to KPMG who supported us with this work, we appreciate you joining. This webinar will be available on replay, so you can access this for yourself or for your colleagues that you think would benefit from this. And again, please reach out to CSG, or you can reach out specifically to me at Schaeffer, that's HSHAFFER at csg.org for further questions on this or other policy and program matters at the state level that CSG can support you on. Thank you, everyone. Best of luck as we continue to navigate this, and we look forward to talking with you again soon.